Computer. Okay, fabulous. All right, so we are here with Ask a Massage Therapist, and since massage is not appropriate right now, I'm so lucky to have our guest co-host today, Danny Lehnert. Danny is a doctor of physical therapy, and he is going to walk us through some strategies and some things that we can do right now when massage is not an option. So, Danny, I know that you let everybody know before we were recording a little bit about who you are and what you do. Would you mind recapping that again one more time for us?
Yeah, no problem. So my name is Danny Lehnert. I'm a doctor of physical therapy. I typically work at a clinic in Reston, but because we're furloughed right now because of the coronavirus crisis, I'm doing a lot of stuff from home, trying to work with people independently, individually. And kind of like Meg's situation, I do a lot of manual therapy and hands-on stuff. So just trying to figure out different strategies I can use with patients to at least give them some relief, even if we can't fix everything during this time. Just some actionable strategies, some things they can do simply at home with no equipment or minimal equipment.
That's great, Danny. And so, in terms of like working with someone online, you'll typically do like a virtual appointment, and do you use kind of like, how do you do that? Do you typically use Zoom? Are you using Doxy.me? Like, how are you working through that?
Usually whatever's easiest for people. I've done Zoom. I've done using Google, like Hangouts or something like that.
Did you guys lose Danny's voice as well? Yeah, we lost your voice for a second there, Danny. Yeah, we still don't have you. The
Okay.
joys of the internet.
Can you hear
While
me now?
Danny is working on getting himself back online, if you guys can hear him as he's testing, oh, you can.
Thank you.
All right, go right ahead.
All right. So what I was saying is kind of whatever people are comfortable with. We're kind of typically I do a lot of stuff with Google because it's HIPAA compliant if you use their business accounts. But if people are comfortable with Zoom or something like that, just because right now I do everything out of network, so I don't really have to listen to insurance companies, but technically with Zoom and stuff, there's a little bit of question mark about HIPAA compliance and everything like that. And insurances aren't even really paying for telehealth right now, or they're paying very little. So that's kind of not even something we're really addressing at this moment. So I'll just usually use whatever people are comfortable with and effective with, and we'll work technologically for them.
Yeah, I mean, I think that's really great. And I think one of the things that I've heard is that there was like a lessening of the rules around HIPAA compliancy right now.
Mm-hmm.
So obviously, if it's a conversation you can have with clients, but right now we're in such unique and unprecedented times that having that flexibility is great. So like Danny, right now massage isn't available, manual therapy isn't available. Do you have any overall or overriding tips for people so that they can kind of proactively avoid aches and pains?
Yeah, I mean the big thing that a lot of people are dealing with right now is back pain or things like that. And a lot of our physical therapy research shows low back pain. We really don't even know what's going on there. So the best thing is just to be healthy overall. So a lot of it is just basic kind of health maintenance tips, things like that. Stay active, stay healthy, try to stay happy. I mean, that's kind of the big thing right now is people's whole life is turned upside down and they're sitting more than they're used to, or they're sitting on their couch or in a uncomfortable chair at their kitchen table. So a lot of it's honestly activity modification of you might not even realize that, oh, I've been sitting at my kitchen table for 8 hours for 2 weeks in a row, and all of a sudden my back hurts now. And they might not even put two and two together. We're just kind of going through their routine because luckily everyone's routines are pretty simple right now. We're working and that's about it. So it's good to kind of go through all that stuff and then kind of touch base on basic activity stuff. Are you getting out walking, running, whatever your flavor of exercise is, some body weight stuff, just to kind of get some sense of normalcy and everything going with that.
Awesome. And Cheryl, we are changing our format a little bit. So we are recording today. Just want to make sure that you're aware and comfortable with that. Danny was just talking to us about overall making sure that, we're including our mental and physical health right now since manual therapy is not an option. Danny, I would love for you to talk a little bit. I mean, you're definitely going to need to take us through some exercises shortly. But
Okay.
before that, I just wanted to see if you could talk to us a little bit about one of the things I think is really interesting with low back pain is disc degeneration. And I know that there have been doctors and chiropractors and that kind of use that term, and it scares people and they think, well, I'm always going to be in pain because I have disc degeneration. But there were some really awesome studies that showed that like everyone has disc degeneration because it's a normal aging process. And just because you have disc degeneration doesn't mean that you have to have pain. There's no direct correlation.
Right.
So can you answer that? And real quickly, I just want to let Anna and Erica know we changed format a little bit today, so we are recording, just so you're aware. Danny, take it away. Talk to us about disc degeneration.
Okay, so tricky topic like you talked about. As human beings, we really want an answer to our problem. So we want to see A plus B equals C. And with our body, that's not always the case. And so, like you said, they've done all these studies showing that it's something like 80% of people will experience some sort of disc degeneration in their life by an MRI or an X-ray or something like that. So if everyone in this room, if you didn't have back pain and we did MRIs on all of us, probably 4 or 5 of us would have disc degeneration, but we would never know it until we have back pain. And so I think that right now it's almost helpful in a way because we definitely see an overuse of MRIs, X-ray imaging, stuff like that with doctors as an easy way to get to the bottom of things, because unfortunately when you go see your doctor, they don't really spend too much time with you. Usually I think the average is like 10 to 15 minutes. So it's a lot easier to say, okay, go get an MRI and come back to me, and then we'll discuss there, and then they look at the MRI and say, oh, it's obviously the disc, and there's no real hands-on assessment or anything like that. So right now we're able to see people virtually where they might not even see their doctor, and MRI is not an option right now. And so you actually have to try other strategies, and maybe hopefully that's something that we can take advantage of and say, oh, well, your back's hurting. Well, let's try a couple things. Oh, this actually feels better. Maybe we don't need to worry about an injection or potentially surgery or things like that down the road. And they've done studies showing that honestly, just educating people that back pain is normal and part of life is helpful. That's a big strategy we use other than get people moving, is just say, hey, statistics show that 80% of people will have low back pain at some point in their life. You're not an anomaly for having it. It's just part of what we do all day. And that kind of gives people some sort of sense of relief of saying, hey, it's okay, my disc isn't going to explode. Because that's the other issue, is we use the analogy of it's like a jelly donut where the donut's going to burst and all this jelly goes into the middle of nowhere, and people think, oh my God, something exploded inside me, I'm going to die. Really, that's not at all what's happening there. It's more like if you tear a muscle or a ligament or something like that, it'll heal itself or scar down. It's just that it's near nerves and it's near your spine, so everyone thinks it's a big deal, and it's going to be the end of your life.
Yeah, and I think like that's one of the things I love about the way that you work, Danny, is that like pain is real, but
Right.
pain isn't always directly correlated with injury. And
Mhm.
injury is real, but it's not always directly correlated with pain. And so I love, well, first of all, thank you so much for like not keeping the myth of the jelly donut alive, because it bugs the out of me when clients are told that. So you
Right.
certainly make my job a little bit easier by explaining, that kind of that a little bit better than
Mhm.
maybe some others have been told in the past. Now, when we can do massage and manual therapy, like one of the strategies I found was with the low back, it was always like a gentler approach was better. And that if we were taking like a broader approach versus kind of, what we call trigger point. And so that
Mhm.
trigger point work sometimes for the low back was not always successful. It was
Right.
more of that like broader approach. And so I would use what traditionally was called myofascial techniques that are kind of like longer stretches to the skin. And there's debate over like whether or not we're really affecting the myofascial
Mhm.
structures, or if what we're doing is just kind of like working those nerves so that our central nervous system kind of sends back a it's okay response. But
Right.
regardless, like that's kind of how I would approach it. If we don't have manual therapy as an option, what kind of exercises like do you recommend, or what is your recommendation for us? And are there generalizations that we can do, or does everyone really need to be individually focused if it's just a little acute pain?
Um, I think there are generalizations you can use. I mean, obviously everyone's body isn't the same, but kind of the mantra we use a lot is like calm stuff down and then build it back up. And so the calm stuff down thing is kind of like you were talking about the myofascial release, the more gentle things where are we really affecting the structure itself? Probably not. It's kind of like using a foam roller. Are you actually moving your fascia around? Probably not. It's just telling your body, hey, calm down. This is a gentle stimulation that's kind of getting the tissues to relax and everything, get a little blood flow in there. And that's what feels good. Versus if, yeah, like you said, a kind of trigger point type thing, or we'll use dry needling sometimes where there are some people that really works well with. If you just strain your QL or something, and that's what we need to address, then sometimes that's what we have to do to get deep into the muscle. But sometimes you do that, and then all of a sudden people came in pain, and now they're saying, well, now it hurts on my right side too. And it didn't hurt there before, because in their mind, they're so caught up in the pain response that they're saying, okay, I'm feeling worse pain. I can't even get a massage now. What am I supposed to do? And so you kind of lose that therapeutic alliance that we try to build with our patients of, if you come in and you say, I'm in 8 out of 10 pain, then I'm not going to say to you, oh, it's all in your head. You're fine, go about doing your day. Even if I think that's what's going on, I need to give you some means to address that. And so I'll ask people, hey, are you a heat person? Are you an ice person? Are you a TENS person? We're using electric stimulation. All those things are going to relieve pain. It's just whatever you're comfortable with. So if you're someone who's like, I hate heat, and I say, well, you need to heat it, then you're not going to have a good experience. And if you're someone who's like, I love ice, and I'm like, you can't use ice, you're like, well, I don't trust this guy. He doesn't know what he's talking about. And so we have people who come in and they'll say, oh, Epsom salt bath, that's the thing for me. Okay, then go do an Epsom salt bath. Or if you say, hey, my chill out is I go for a walk. Okay, then go for a walk. And just get everything to kind of calm down. And then we get into the building stuff up phase, which is what we call like graded exposure. So for us, usually looking at it muscularly is we start with what are called isometrics, or where you're engaging the muscle, but you're just holding it in one position for longer periods of time. So a basic example would be like a plank or something like that. So basically what you're doing with the plank is you're engaging your core, you're engaging your back, but you're not moving it through any sort of range of motion. People can normally tolerate that better, but that's giving you blood flow and stimulation of the muscle and saying, hey, I can activate this muscle and my back's not going to explode. And so basically they get that feeling and that confidence to say, okay, I feel like I'm exercising. I feel like I'm working out. Okay, now we say maybe go for a walk, something like that, even if it's just 5 or 10 minutes a couple times a day, just so they get in their head that, hey, I can move and it's not going to ruin me. Even if your pain doesn't get better, at least it doesn't get worse. And you can still be active and do things. And basically then you can kind of keep progressing it to, where do you want to be? Do you want to get back to the gym and lift weights? Do you want to run? Do you want to row, swim, whatever it is? Then we just kind of gradually build up to that, doing an isometric type thing first, and then going through that range gently to gain that confidence back, because a lot of times that's what it is. Your body's just guarding against itself.
I like what you said too. It's like I will talk a lot of times with my clients that have like longer or chronic pain.
Mm-hmm.
We are having them succeed through their pain, right?
Right.
So like sometimes that we know, like, I mean, if your body has been giving you a pain response for years,
Mm-hmm.
like I would love to say you're going to see me once and it's going to be gone, but that's not, I'm not that good.
Yeah.
Sometimes I get lucky and someone will see me and that will happen, but typically that's not going to happen. And so it's, how can we reframe things so that you can build up to do the things that you miss doing and succeed through your pain? Would you agree with that statement, or?
I would completely agree with it, because we'll tell people, hey, if you actually did herniated disc, most of the time that's going to resolve within 6 weeks. And sometimes we'll see people who have had back pain for 3 years from what they think is a herniated disc. And physiologically, that's not really possible. The disc will scar down, it'll heal itself, it'll figure things out, and your body will adjust around it. So you kind of have to walk a fine line of saying, yes, I acknowledge that you're in pain, you're going through a lot right now. I'm sure that is unfortunate that you can't play with your kids or play with your dog or whatever it is that you want to do. But let's try to look at it in a different way and say, okay, well, your body has probably actually healed in what it needs to do. Now the question is, how do we get you back to doing what you need to if that healing response has taken time and occurred? And it's just giving them that information of, kind of like you said, I mean, I think the worst thing as healthcare practitioners we could do would be to say, oh, you need to come see me 3 times a week forever, to try to chase some relief that might not happen. And a lot of that, it is an individual thing. And we need to be empowering people where I'm kind of your guide on this journey, but you're going on the journey yourself. I can't physically go in there, reach in and fix your disc or something like that. And you need to go on that path, and I'll just kind of be there as the guardrails to make sure you're okay.
All right, so now we have a better understanding, and everyone hopefully understands that, like, you know, I think first and foremost, it's like building that therapeutic relationship and like making sure that your health and wellness professionals like understand that your pain is real. There might not be injury, but your pain is real. And that, I think if you're coming from a starting point of that, I feel like, you know, you can be successful regardless of what the results are. So Danny, now that we kind of know a little bit of background and a couple of things that we can do, can you take us through maybe some exercises that we can do if we're having an acute spout of low back pain or in general?
Yeah, I mean, like I said, the actual research is not great on specific exercise or things like that. A lot of what we promote is movement. So walking is going to be the simplest thing. But kind of like we talked about, if you're sitting for a long time in a chair you're not used to or in a way you're not used to. I know for me, typically at work, I'll sit on the computer for a while to write notes, but then I get up and interact with patients, something like that. Nowadays, I just sit. Even if I'm working with someone online, I'm still sitting. So that's completely different for my body. So something we'll try with people is if you're standing and you have more pain bending forward trying to touch your toes than trying to bend back as if you're looking up at the ceiling, we'll tell people to do kind of like a cobra pose from yoga, as if we call it a prone press up because we have to come up with our own names for everything. So basically a push up where you're just leaving your hips and everything on the ground, because what we're trying to do is if you're sitting all day in this kind of flex forward posture here, just trying to reverse the posture a little bit. And what that's doing is that's not necessarily fixing anything. It's more so just giving your joints the feeling of, okay, we're going through a different range of motion versus sitting like this the whole time. So with people, it's just as far as you're comfortable. So some people can only get up on their elbows. Some people can go all the way up on their hands like you're doing a push-up, but with your hips down. And it's just going into that position throughout the day. It's the same thing that a foam roller does if you're rolling on that in your mid-back or something like that. It's just giving you a new movement sensation for your body to say, okay, I can do this, and it feels okay, and I'm moving around.
All right. So I'm going to be the guinea pig here, and I'm going to try and do a cobra pose. And by the way, Gretchen, who is usually my yoga teacher, knows how much I am not a fan of yoga. So we'll see how this goes. All right, let's see if I can get myself set up here. All right. So for what we call a cobra, right? So you said push up, but my hips are going to hit the ground.
Exactly.
So,
yep.
like
Just kind
here?
of like that.
All right. So like here, and if my yogi was with me, she'd be telling me to keep my head straight, right? Do you really care about whether our head moves to the left, right, up, down?
If you have neck pain, I care. Just go in the position that doesn't cause you neck pain.
Okay. And if I do this and it's like aggravating my low back,
then not good.
Yeah. So it's like you have to do what's comfortable for you. All right.
Yes.
Now that I'm on the ground, take us through our next move.
So what I was going to say is if that is more uncomfortable for you to extend like that, then sometimes when people sit, we kind of do what we call an anterior pelvic tilt, which is where almost like your belly is sticking out more when you're sitting. So you kind of get overly upright, like you think, oh,
And we lost you again, Danny. He's saying so many wonderful things and we can't hear him. We can't hear you. No, not yet. All right, but I think what he's saying.
Can you hear me now?
Yes, I got you again. Okay, so anterior tilt is normally what we're doing.
Right. So what I was basically saying is, if the cobra causes you more pain, do more of a child's pose. Flex your low back more than extend it, and find what's more comfortable for you, and it's going to give you that relief versus just saying you have to hammer one position over and over again.
Okay.
Same reason we have standing desks or anything like that, is you're just moving things around.
Great. So move things around a little bit during the day. Move from sitting to standing. It doesn't really matter if we're sitting, standing. It's kind of more of just staying in the position, in one position all day, which is not really great. We can do a little bit of cobra. If cobra doesn't work, we can do a little bit of child's pose. I'm sorry. Wait, what do we call it in the PT world? We call the cobra what?
Prone press up is the
Prone press up. So I've learned something new. All right. And once we graduate from that, what's next?
So then we would get more towards muscle activation type stuff. So if the cobra is the more comfortable thing for you, then we're going to be going more towards extension exercises. So that's more standing stuff, or the most basic one would be a bridge. Because when you bridge, you're squeezing your butt muscles, you're lifting your hips up, effectively extending your low back slightly. With the bridge, I'll have people go as far as they're comfortable, because sometimes we'll see gymnasts who do the full back bend and it looks like a scary child in a horror movie. We don't want that.
All right. Am I doing it?
You're doing it. Yes. Look at that form. Perfect. And so with these, when we're first starting with the isometrics, we're really cueing people, hold it for like 10 seconds and do it 3 or 5 times or something like that. Really squeezing your glutes, really holding that position versus just going up, down, up, down. Does that make sense?
Yes.
Okay. And then if you're more comfortable bending forward kind of in the child's pose, it would be more things if you've ever seen like a dead bug or something like that, where you're laying on your back, pushing your low back down into the ground. You're doing a great job.
All right. So let's see. Dead bug like this, right?
Yeah. So if we were to start and we're just getting started, all we're doing is you're laying down. Oh, I froze again.
You're frozen, but we can hear you.
Okay, perfect. You're laying down, so you're pushing your low back into the ground and just marching your legs up, one and then the other.
So just this.
I can't see you. I assume you're doing it correctly because my screen's
All right, everyone's got me, yeah. And one leg at a time, Danny, right?
Yes, like that. Even easier if you keep the knees bent. So basically all that's doing is keeping you in a flexed posture with your low back, but it's still activating the muscles in a way that's usually easier on you.
All right, Danny, and I'm going to ask you a question. So
Go for it.
when we're supposed to keep our back on the ground, right?
Mm-hmm.
A lot of times, like I got a badunkadunk and I got a little bit of a curve. So even it's really impossible for me to keep my spine completely on the ground, I feel like. And a lot of times when I'm in classes, I'm almost made to feel like, well, you just can't figure it out yet, but you'll get there eventually, or you don't know what you're doing, right? Are there people that your curvature might be enough where you can never get it fully on the ground?
Yes. Yeah. So that's great marketing of saying you have to get there, otherwise you fail. But basically, as long as we give people that cue, because a lot of people, when you do any sort of dead bug or leg lift, if you arch your back up a lot, you're not using your core anymore. You're more just causing low back pain. So it's supposed to be thinking about driving your low back down. If you can't touch the ground, and if I were there, obviously I would kind of be poking and prodding you saying, are these muscles activating like we want them to? As long as you're envisioning it and have experience with it, which someone who's done yoga or Pilates or anything will have that experience, then I'm comfortable online saying, okay, just think of doing a pelvic tilt like that. I'm sure you're doing it correctly. Don't worry about your back actually touching the ground. Because there are some people who will do it too much and their back hurts. And I'll say, okay, just do 50% of that. Because I don't need your back to touch the ground. That's not actually that important. It's just more so activating the muscles, giving you that perception of it.
So I don't have to be like an overachiever. I can keep my knees bent if that's going to put me in a better position.
Yeah, and with some people, will even put a pillow under their back if they really can't get it very far down, and that gives you some sort of tactile cue to push into, but you're not forced to go as far down into that painful response. And I mean, there are some people who just can't figure out how to move their pelvis or do things like that. Like, we can take a long time doing it. I'll just typically move on to something else, especially if we're doing it online and we just can't figure it out. But most people have some idea. They've done some sort of yoga, Pilates, plank, something like that, where they've been coached in how to do that. Otherwise, we'll just move on to something else.
Yeah, well, I think that's a wonderful thing too, is like it doesn't have, there's no like one exercise and one way to approach it, right? So when you're working with someone, just like if you're not able to kind of capture something or not able to figure something out, ask them to give you something else, or ask them for a different cue, or ask them for a different exercise. All right, Danny, we are wrapping up on time wise, but so we've gone over a couple exercises. We are going to start going for walks with our masks on, right? I don't know. Well, what's your theory on the like mask, no mask?
That is way out of my scope of practice. I'm not going to answer that.
Okay, great. So yeah, so you guys are gonna do your research and go for walks. I am really excited, and Danny, maybe you could talk about this. So I'm just gonna give everybody a little background. I always like listen to Danny, and then sometimes I do my own thing, and then Danny goes, "Why are you doing that?" So most recently it was like the shoes that I'm wearing. He's like, "Those are the shoes you're running in?" Like, Meg, I know we have some flexibility in what we do, but like, come on. So my most recent thing is now I just bought a trampoline so I can run inside since I don't have room for a treadmill. What are your thoughts on that, Danny?
Um, so where I used to work at a clinic in Leesburg, they opened up one of those trampoline fitness places, like right down the street from us. We got so many evals from there. It was incredible. So, it's whatever you want it to be.
All right, so maybe I need to book a session with you to make sure that I'm properly using my trampoline before I get started.
I mean, if you have basic conditioning and take it slow, it's fine. It's just that what they were doing was throwing people into it right away. It's the same thing where CrossFit or anything else gets a bad name of people have never lifted a weight in their life, and then all of a sudden they have 100 pounds over their head and they don't know how it got there, and now their shoulder hurts.
Yeah.
So you've run plenty, so you probably know your own body well enough to handle it smartly. But if you were someone who had never worked out before, I would say that's probably not a good idea.
Okay. All right, great. So any other advice before we move over to Q&A?
No, I mean, I think, like I said, it's overall just being healthy, understanding, low back pain is normal, everything like that, and just trying to find your happy place, as dumb as that sounds, because we have some people who come in with crippling pain, and they're like, it only feels good when I sit in my couch and watch Netflix. And I'm like, well, don't feel guilty about sitting on your couch and watching Netflix. If that takes you out of that pain, don't feel bad about it, because we need to get you out of that and then figure out other stuff we can do. And a lot of people, especially right now, feel like, oh, I have to go crazy and run a marathon or something like that, or do 100 push-ups a day for some stupid Instagram challenge or something like that. And then they're like, I'm a failure because I'm not exercising or something like that. And that's obviously the exact opposite of what we want. We want you to exercise what's comfortable for you, but not feel like you have to go crazy.
Okay, so who has, does anyone have any questions for Danny? And I just want to be respectful of everyone's time. Right now it is 12:32. So we'll probably go to 12:45. If anyone has to drop off, feel free. I'm going to go ahead and start in my top left-hand corner. I'll start with Phyllis, and then we'll go to Anna's question.
Hi, Danny.
Hi.
Thank you and Meg for that session. That was really cool. My question is, why is lower back pain so common? Why not, middle back pain or upper back pain? What is it about the low back that makes it so much more susceptible?
Good question. Full disclosure, we don't totally know. I think a lot of it is because your mid back or your thoracic spine is very stable by nature, because you have all your ribs and everything like that. So when you bend forward or bend backwards, most of the motion is coming from your low back. And so what actually ends up happening with most people is their low back becomes we call it unstable. It's not really unstable, but it just becomes too loose in essence, is you don't have enough muscles. And so that's why when we're treating someone, normally we'll start with range of motion stuff like the Cobra or anything like that. But our goal is not to turn you into a dancer where you can do a full back bend and touch the ground and everything like that. That doesn't really matter. It's usually just an area that there's a lot of mobility, and then your body just doesn't know how to compensate. The other thing is we sit a lot, and the sitting just takes a toll on it. I mean, we see a lot of neck pain as well. So it's kind of a little bit of everything, and also the low back is just kind of demonized and stigmatized. So if you get, pain in your mid back, you're like, oh, whatever, it'll go away. If you get pain in your low back, you're like, oh my God, my life's over, because my uncle had low back pain and now he's in a wheelchair. Unfortunately, that is what we see sometimes with people.
Anna, you had a question? And we're just going to wait a moment for her.
Sorry, I just had to unmute myself. So my question is actually more for my daughter.
Okay.
She's 15. Her back hurts quite a lot, and she actually wants me to crack her back almost every day. Okay. So I'm not sure how, I learned some techniques from my old chiropractor, but I'm not, are we doing more damage than helping her out? What's the scoop on cracking backs?
Well, I'm going to let Danny cover that one.
Loaded question. So first of all, to cover my butt, there is some risk in doing that, obviously. The risk is minimal compared to what we think it is. Some people think you're going to crack your back and become paralyzed. Is that going to happen? Probably not. Honestly, your low back is a pretty safe area because your spinal cord actually ends around like your upper lumbar spine. So there's really not too much damage you can do there. That being said, don't go too crazy. Honestly, it's probably not hurting anything, but it's probably not helping anything either, because for physical therapy, we have what are called clinical practice guidelines, which is where we try to lump people into categories as much as we can, which is really hard because everyone's the same. But usually cracking, or what we call manipulating your low back, is only helpful in like very acute episodes. Like you can sometimes have it where a segment becomes stuck, and if you crack it, it gets loose and then not pain anymore. That's actually pretty rare. And so if it's chronic pain, usually it's not very helpful, because like I said, those people are usually honestly unstable in that they don't have any muscle around there, or very little. And especially with teenage girls, that's a huge problem we see, is that they're hypermobile, just based on hormones and body structure and everything like that. And then it can honestly become a sort of mental thing, which is what we try to avoid with people, because I mean, I do crack people's backs sometimes, but what you don't want it to become is a habit, because then there's kind of a mental stimulation, almost like you release endorphins by doing it. And you think that if my back doesn't crack, then it feels stiff, when they've done research showing that honestly, your back is not actually that much looser after you crack it. It's just that now in your head it's looser, so you're more comfortable going into different ranges, things like that. So in some cases I will do it, but I try not to make it a habit, especially for young female patients, because they think they need it, and then really they just need to get stronger and get some more stability. Because if you don't have that stability, then it's going to be painful kind of doing a little bit of everything, especially if you're in one position for a long time. Does that make sense?
Thank you.
And Danny, is the kind of the crack noise when you're cracking your back, is that similar to like when you're cracking your knuckles, where I believe the most recent theory is that there's pockets of air that are building up in the synovial fluid, and when you're pulling them apart, all of those molecules of gas are kind of coming together, creating like what sounds like a pop, but is actually like a suction of all the air coming together. And then sometimes when you release, there's another pop, which is that kind of gas releasing and spreading back apart again. Is that noise and that kind of that feel good noise, that's similar? Yes?
Yes. So research wise, it shows that if you do get that, we call it a cavitation or a pop, then the manipulation is more effective. That could just be because the person hears it and feels it, because a lot of times I'll go to manipulate someone's back, and if you don't get a pop, they'll be like, oh, you didn't get it. I'm like, okay, well, let's try to move. And they can move a little bit better. I'm like, then why do we need it to pop? So it's kind of educating them on that. And honestly, the biggest prediction rule of a manipulation being successful is if a person believes it'll be successful. So we always ask people before we do it for legal reasons. I'm not going to crack your back without telling you, because then you could sue me. But if I ask you to do it and you seem hesitant, or you say, hey, you know, I went to a chiropractor a few years ago and I didn't have a good experience with it, then I'm not going to do it to you. Versus some people who are like, oh yeah, do it, that's fine, maybe it'll help. That's a good thing, but it's honestly the person's expectations of, will this help me or not? If they don't think it's going to help, then it's probably not going to help, and I'm honestly just wasting my time doing it.
And we're going to go to Erica next, but before we do, I have also seen studies that say the old tale of if you crack your knuckles that you'll end up with arthritis. That's been, the studies show that's not the case. Is that what your understanding is as well?
Yeah, we'll tell people try not to overdo it, just because, like I said, you can kind of create a mental fixation on it, but you're not actually going to, statistically, it doesn't show that you're going to get arthritis or anything. I mean, it's obviously a really hard thing to study, of like, how do you tell if someone's cracked themselves enough? The only, honestly, thing I've ever seen, and this is anecdotal, was there was some scientist who only cracked his knuckles on one side, and they did studies like 40 years later, and his joints look the same. I mean, I don't know how else you could control an experiment like that.
Right. I mean, one person is not really, doesn't make for a good study. So
right, exactly.
I mean, yeah. But anecdotally. All right. Erica, you had a question as well?
Yeah, basically the same about that, what Anna was saying about the teenagers, and they practicing all these sports, and sometimes they damage for the heavy weight or stuff like that. But yeah, they're a pain. I was gonna say, but no, it's fine. Yeah, in the other sense, it's like I have in myself a injury in the right ankle, because I damaged like a long time ago, 3-4 years. But then, you know, passing that therapy and everything is constant. They come back like a little bit pain. It's like the memory of the whole injury. I think it will be good to check with the physical therapist or maybe chiropractor, because like I say, sometimes it comes when I run a lot. So what do you recommend?
So running pain, right? So like she had an injury, and then it sounds to me like the injury's been fixed, but her body sometimes says, oh yeah, I remember that, and is sending pain signals. Am I on the right course, Danny?
Yeah, I think so. So it can be a couple things. Like we talked about, the chronic pain of that tissue just feels like it's in pain when you load it a certain amount or do certain things. But the other thing, it's a really good point to touch on, is the reason your back gets hurt a lot is because everything involves your back. So a lot of times we'll see people who will say, oh, my back pain started after an ankle injury, but they don't even realize that. We'll have them do a questionnaire of past injuries, be like, oh, I had ankle surgery 5 years ago. When did your back pain start? 5 years ago. Do you think that's related? No, it couldn't be. And so I think that also what we try to do is more complete movement screens of saying, not only could it be that your body remembers the injury, but it can also be that your body's still compensating for it in a certain way, where you may feel the pain where the injury was, but if, for instance, you know, your calf is doing something different, or even your knee or your hip, it could be putting stress in that area or pinching a nerve or something like that, where even if you're not in pain and you're not even having a chronic pain response, your body may still remember, hey, it hurts to run this way all those years ago, I'm going to run this way, or something like that. Or when you get fatigued, certain muscles get fatigued. So that's why if you go to any sort of physical therapist, chiropractor, or anything like that, they should be doing a full sort of movement screen and assessment, stuff like that. Like if someone comes in to me and says their back hurts, I'm not just going to look at their back. You got to check off some other boxes and make sure things aren't causing it that you're just completely going to miss. And so that's kind of crucial too, is your body may have just adapted in a strange way to running.
All right. And in the essence of making sure that we stay somewhat on time, Danny, if somebody wants to kind of take it a little bit further and set up an appointment with you, what is the best way for them to get in touch with you right now? Are you taking on new clients for virtual?
Yeah, so I am. So it's kind of in the works of getting everything started. Haven't put up a website or anything yet. Turned out that's really hard to do. Respect to all of you who have websites and everything like that. Taking that for granted.
Let me know. I can totally help you with the DIY and what not to do.
I think I get it. It's just time consuming. But I have Instagram, Twitter, all that stuff on those at Dr. Danny DPT. You can also reach out to me. You can feel free to send me a text or give me a call. My number is 571-643-2398.
I think it's so great that you thought that I could type that fast.
I'll put that in the chat. Hang on.
Okay, great. Quick and me don't happen together.
That's fine. I'm going to correct the Instagram because you put Dr. Panny DPT. That might be someone else. I don't know what their credentials are.
Thank you. I don't know if I can delete it either. I will delete it when I do the notes.
That's fine. So I put my actual one on there. So feel free to reach out to me on there or text me or anything like that. And it doesn't even have to be anything formal. If you just have quick questions or anything like that, I'm more than happy to answer. Should I be doing this or that or things like that? Because right now it's just trying, like I said, to kind of get people through this whole thing of let's try to get you through it feeling as good as we can. And then if it's something we need to address when everything's back to normal, then we can do it then. But I don't want you to say, oh, I can't run during this time or I can't sit for more than an hour during this time. We need to try to knock that stuff off if we can.
Great. Does anyone else have any questions before we let Danny go today?
No, but I just want to say thanks, Danny. You're always so generous with the information, and you say it in a way that really makes sense, and you're just so real. I just appreciate that. Thank you.
Thank you. I appreciate that. It means a lot.
All right, perfect. Well, that is it for today then. Next week, just so everyone knows, next Wednesday, we have Gal on the Go. She does movement and yoga exercises to funky beat. She used to be a college DJ. So join us for Kimberly next week, and she'll take us through some movement exercises. And I don't know, I told her, listen, I'm a child of the 90s, so we'll probably have some grunge music. I don't know. We'll see what happens. But thanks again to Dr. Danny, our physical therapist. And now that you have the correct Instagram for him, you can get in touch with him. And of course, if anybody ever has any questions or needs to get in touch with him and can't, you can always reach out to me and I'll put you in touch with Danny. He's certainly helped me get through some acute issues that I've had. So I highly recommend working with him. Thank you guys so much. All right. We'll see you next week.
Thank you.
Bye.
Thanks, everyone.